prostate cancer, the silent threat thousands of men are unknowingly living with a ticking time bomb, prostate cancer. This silent disease often develops without obvious symptoms, remaining undetected until it reaches an advanced stage, making it much harder to treat. But here's the good news: early detection can save lives. Did you know that 1 in 8 men will be diagnosed with prostate cancer in their lifetime? That's a staggering statistic we can't afford to ignore. In the US alone, over 288,000 new cases are expected this year, and nearly 34,700 men will lose their battle with this disease. However, when detected early, prostate cancer has a 98% survival rate. That's why recognizing the early warning signs is crucial. Don't ignore changes in your body, your health is too important. In this guide, we'll cover 8 early symptoms of prostate cancer that should never be overlooked. Understanding prostate cancer. Before we dive into the warning signs, let's take a moment to understand why prostate cancer is so dangerous. The prostate is a small, walnut-shaped gland located just below the bladder. It plays a critical role in male reproductive health by producing seminal fluid, which nourishes and protects sperm. The most common type of prostate cancer is adenocarcinoma, which starts in the glandular cells of the prostate. However, not all prostate cancers behave the same way. Some grow so slowly that they may not cause noticeable symptoms for years, lulling men into a false sense of security. On the other hand, aggressive forms of prostate cancer spread quickly, affecting nearby organs and even distant parts of the body. These cases require urgent medical attention. That's why knowing the warning signs and acting early is so important. The 8 early warning signs of prostate cancer: pain in the back, hips, or chest. Chronic pain in your back, hips, or chest might seem unrelated to prostate health, but it can be a warning sign that the disease has progressed. While aches in these areas are often attributed to aging or physical strain, they can also indicate that prostate cancer has spread to the bones. Once prostate cancer reaches an advanced stage, it often metastasizes to the bones, leading to persistent, deep-seated pain. Unlike typical muscle or joint pain, this discomfort doesn't improve with rest and may gradually worsen over time. If you're experiencing bone pain that won't go away, it's a red flag that requires immediate medical attention. Ignoring this symptom can delay a critical diagnosis. If your pain persists despite rest or treatment, don't dismiss it as just aging or overexertion. Prostate cancer that has spread to the bones is more challenging to treat, but early intervention can help manage the disease and improve your quality of life. Listen to your body. Persistent pain deserves medical evaluation. Swelling in the legs or feet. Swelling in the legs or feet might not seem directly connected to prostate cancer, but it can be a subtle sign of something serious. Known as edema, this type of swelling happens when fluid builds up in the lower limbs, often causing discomfort and inflammation. So, what's the connection? When prostate cancer spreads, it can invade nearby lymph nodes. These nodes are part of your body's lymphatic system, which helps drain excess fluid. If they become blocked or damaged by cancer cells, the fluid has nowhere to go, leading to noticeable swelling in the legs and feet. While other health conditions, such as heart disease, kidney problems, or prolonged inactivity, can also cause swelling, cancer-related swelling often doesn't resolve on its own and may progressively worsen. It may also come with discomfort, tightness, or changes in skin texture. If you notice swelling along with other symptoms like pelvic pain, urinary issues, or bone pain, it's time to see a doctor. Swelling might seem minor, but in combination with other warning signs, it could help detect prostate cancer early, when treatment is most effective. Your body is trying to tell you something, don't ignore it. Blood in urine or semen. Seeing blood in your urine or semen can be alarming, and for good reason. It's a sign that something isn't right. This condition, known as hematuria, blood in urine, or hematospermia, blood in semen, can appear as visible streaks or only be detected under a microscope. Either way, it's not something to ignore. So, what causes this? In cases of prostate cancer, blood in urine or semen often results from vascular damage or tumor growth within or near the prostate. As the tumor develops, it can disrupt nearby blood vessels, leading to bleeding that mixes with urine or seminal fluid. However, cancer isn't the only possible cause. Infections, prostate inflammation, prostatitis, or urinary tract injuries can also lead to this symptom. Why is this so urgent? While not every case of blood in urine or semen is caused by cancer, there's no way to know for sure without proper medical testing. Ignoring it could delay treatment for a potentially serious condition. The sooner you see a doctor, the better your chances of identifying and addressing the root cause. Pain while sitting. Experiencing pain or discomfort while sitting might seem like a minor issue, but it could be an important warning sign of prostate cancer. This discomfort can range from mild, nagging aches to sharper, more intense pain in the pelvic region. Why does this happen? The prostate sits just below the bladder and in front of the rectum. When it becomes enlarged or a tumor develops, it can create pressure in this area, making sitting uncomfortable. In advanced cases, prostate cancer may spread to nearby tissues, intensifying the pain and making simple activities like sitting down unbearable. This type of pain may also radiate to the lower back, hips, or thighs, making it harder to pinpoint the exact cause. While other conditions like prostatitis or benign prostatic hyperplasia, BPH, can also cause pelvic pain, persistent or worsening discomfort should never be ignored. Pain while sitting isn't just a physical symptom, it can interfere with your daily life, making it hard to focus, relax, or enjoy simple activities. If you experience this regularly, especially alongside other symptoms like urinary changes or painful ejaculation, it's time to seek medical advice. Early detection is key to protecting your health. Frequent urination and nocturia, waking up at night to urinate. Have you noticed that you're going to the bathroom more often, especially at night? Maybe it's disrupting your sleep and leaving you exhausted during the day. Frequent urination or nocturia can be an early red flag for prostate cancer. The prostate gland surrounds the urethra, the tube that carries urine out of the body. If the prostate becomes enlarged, due to cancer or other conditions, it can press against the urethra, making it harder for urine to pass. This leads to increased frequency, urgency, and difficulty fully emptying the bladder. While conditions like benign prostatic hyperplasia, BPH, or an overactive bladder can also cause these symptoms, persistent or worsening urinary changes shouldn't be dismissed as just a normal part of aging. Your body is sending you a signal, listen to it. Painful ejaculation. This is a less talked about symptom, but one that shouldn't be ignored. If you experience pain or discomfort during ejaculation, it could be a sign of underlying prostate issues, including cancer. The prostate gland produces seminal fluid, which mixes with sperm to form semen. When cancer affects the prostate, it can cause inflammation, irritation, or structural changes, leading to pain or discomfort during ejaculation. The pain may be felt in different areas, including the penis, testicles, rectum, or lower abdomen. While painful ejaculation can also result from prostatitis, inflammation of the prostate, or BPH, when it occurs alongside other warning signs like frequent urination or difficulty urinating, it may be linked to prostate cancer. Ignoring this symptom can affect your quality of life, both physically and emotionally. If this issue persists or worsens, it's essential to talk to your doctor. Open conversations about your health can lead to early diagnosis and life-saving treatment. Unintentional weight loss: losing weight without trying? That's a red flag. If you haven't changed your diet or exercise routine but are dropping pounds, it could be a sign of prostate cancer. Cancer cells disrupt the body's metabolism, using up energy and nutrients, leading to rapid, unexplained weight loss. This often comes with fatigue, making you feel drained despite eating normally. If this symptom appears alongside pelvic pain, urinary changes, or blood in your urine or semen, don't ignore it. Unexplained weight loss warrants immediate medical attention. Numbness or weakness in limbs: experiencing tingling, weakness, or numbness in your arms or legs. This could signal advanced prostate cancer that has spread to the spine, compressing the spinal cord. Prostate cancer commonly metastasizes to bones, including the vertebrae. When this happens, it can affect nerve function, leading to limb weakness, difficulty walking, or even loss of bladder and bowel control, signs that require urgent medical care. Ignoring these symptoms could lead to permanent nerve damage or paralysis. If you experience unexplained numbness or weakness, see a doctor immediately. Risk factors for prostate cancer: age increases the risk, especially after 50, with most cases diagnosed in men over 65. A family history of prostate or breast cancer significantly raises the likelihood of developing the disease, especially if genetic mutations like BRCA are present. African American men have a higher risk and are more likely to develop aggressive prostate cancer. Lifestyle factors also play a role: obesity, a diet high in red or processed meat, and lack of exercise can increase the risk. Prevention strategies: healthy diet rich in fruits, vegetables, whole grains, and lean proteins can lower prostate cancer risk. Foods like tomatoes, high in lycopene, and cruciferous vegetables, broccoli, Brussels sprouts, offer added benefits. Regular exercise, with at least 30 minutes of moderate activity 3 times a week, can help regulate hormones and strengthen the immune system. Maintaining a healthy weight is crucial, as obesity is linked to more aggressive forms of prostate cancer. If you have a family history of the disease, discuss PSA screening and other early detection methods with your doctor.